Welcome back to KVUE News Midday. A new study finds people who have good heart health scores in their midlife can lower their risk of dementia later in life. Heart Hospital of Austin cardiologist Dr. Vivek Goswami is joining us now. Good morning to you, Doc.
Good morning.
So tell us a little bit more about what this study actually looked at.
Yeah, sure. So just to provide some background, dementia, unfortunately, is very common. Over 5 million Americans are suffering from dementia, and that number is only expected to increase as our population ages. And despite the quality of life limitations of dementia, there's currently no cure. So this becomes an ideal scenario where prevention is key. Well, as it turns out, this most recent study, along with prior studies, suggests that the same things that could prevent cardiovascular disease are the same things that could prevent dementia later on in life. So we know that by eating well, by keeping our weight down, by exercising and avoiding things like cigarette smoke, not only do we live longer, reduce heart attack and stroke, not only do we prevent diabetes, high blood pressure, and high cholesterol, these same things also prevent dementia. So I think most people tend to think of dementia as something that affects elderly people, but I think it's important to keep into perspective that when people develop dementia later on in life, it's not because of what they did later on in life. That process starts much earlier on. And this study is a great reminder that our day-to-day activities really impact our downstream health.
One of the things we want to point out is it's never too late to start taking better care of yourself, right?
You're exactly right. Yeah. So our body is constantly in balance, and there's relatively immediate gains to be had if an individual starts to exercise and starts to eat correctly, for example, and avoiding cigarette smoking. The inflammation and some of the other mechanisms that cause this plaque to form in our arteries can decrease almost immediately. And the mechanism here, Ashley, is that, the same plaque that could form in our arteries due to these uncontrolled risk factors, that plaque can potentially form in the small vessels, giving blood supply to the brain, and that's thought to be some of the mechanisms of this dementia.
Doctor, it sounds easy enough, right? Exercise, eat well, stop smoking. Then why is it so hard for people to do, you think?
I ask myself that every day, and a big part of everything we do on a day-to-day basis as preventative cardiologists is to really provide that perspective for our patients. A lot of people think that just because you have a family history of a certain illness, maybe your mom or dad had heart disease, maybe your mom or dad suffered from dementia, and they throw their hands up in the air feeling that that's their destiny. I think it's important to remind people, despite what your parents may have and despite diseases that may run in your family, we still have a tremendous amount of control as to what happens to us. And I think adopting these healthy lifestyle measures really help. No one's going to take better care of us than ourselves. And what we do on a day-to-day basis is really the most important thing.
All right, fantastic. Thank you so much, Doctor, for sharing this with us. If folks want to find out some more information, what resource would you say they should go to just kind of learn how to start making some of these changes?
Yeah, I would start with the American Heart Association's website. I think there's a lot of resources on there and a lot of good guides on diet, exercise, and recommendations. So please visit the American Heart Association's website.
Easy to remember. Dr. Goswami, we thank you so much for taking some time to chat with us today.
Thanks for having me. I certainly appreciate it.